There are now just 60 GPs for every 100,000 patients in the UK, according to new research by the Nuffield Trust.
So how do we encourage more people into the profession and stop others from leaving?
Well, our health correspondent Dominic Hughes is looking at the pressures facing doctors at a practice in Ashton in Makerfield this morning. Very good morning to you.
Yes, good morning from the Ashton Medical Centre just outside Wigan. This is it's part of a confederation of GP surgeries, 35 locations across the northwest of England, looking after around 140,000 patients. So to discuss some of those issues facing GPs and how you alleviate some of the pressures on GP services, I'm delighted to say I'm joined by two people, Dr. Shikha Pitalia, who's the senior partner here at the Ashton Medical Centre, and also Graham Wardle, who's the chairman of the Patient Participation Group. Thanks very much, both of you, for joining us. To start with, Dr. Pitalia, what can you do? What do you do here that's different to try and alleviate some of those pressures that GPs are facing?
Good morning. Thank you. Yes, the changes have started to happen gradually over many years now. And what we've worked really hard to do is listen to our patients, speak to our doctors, try and understand what are the challenges that are facing them. One of the main things we believe is patients are living longer, they have complex diseases, diabetes, heart disease, etc. And we have wonderful treatments, which is great, but because of that, the workload increases. So you have to see more patients with complex diseases that take longer than a 10-minute appointment. Paperwork consequently increases and doctors feel burdened. So we have to do things differently. So we introduced a variety of support mechanisms. So we have pharmacists, advanced nurse practitioners, nurses working as a team to try and deliver the best and safest care for our patients.
So lots of medical experts doing things that GPs might otherwise once have done. Graham, what sort of difference does it make to patients when this works well?
In terms of working with the patients, there's a very good network between the practices within the SSP. I chair the Braithwaite Road surgery, which is one of the practices within SSP, and we find we have this very good working relationship both between the clinical staff, the administrative staff and also the patients. We have a group of patients who tell us what they feel they need, and we put clinics in place to discuss their suggestions as to how things can be made better, and then we can therefore pass the views back through to SSP and also to the wider CCG.
So lots of communication then between patients and the doctors here.
Yeah, I think one of the most important things is communication, not only within the networks for the practices, but also to provide up and down communication through from CCG right through to the patient.
Okay,
there's a lot of feedback.
Okay, thanks. Very interesting. Thank you very much. We'll be bringing you more from the Ashton Medical Centre throughout the morning, and coverage right throughout the day across BBC News on the pressures facing GPs. Back to you.
Thank you very much, Dominic.
Let's talk